Okay, tonight, well, this month we're going to talk about arthritis reversal, but arthritis reversal from a different standpoint, okay, because we've already done reversal of arthritis, but we're going to concentrate on drugs and diet, because the drugs are actually causing a lot of the drugs they use to treat it, and the diet is actually one of the solutions for it. So today I'm going to ask a couple of questions at the end, and you will get a free book. And in fact, we're also, for the people on YouTube, we're going to give away 10 of these free books if you can ask some of the questions at the end. I'm giving away these because I made spelling errors in this one. The people on YouTube will have the real one. And when I ordered it, I didn't order proofs. I actually ordered a bunch that have spelling errors. But Einstein did say, it takes a small mind to spell a word only one way. Okay, so arthritis reversal, and when we look at my authority for talking about arthritis is about 25 years ago I was hit by a car, had my sternum fractured, both legs fractured, my front teeth knocked out, God bless the dentist in Mexico for fixing them, my skull fractured, my liver bruised, and my heart bruised. So you know, after 4 operations, the doctor said, hey, you know, you're going to hurt for the rest of your life, we're going to give you drugs, you'll be fine. Okay. They think being on drugs and reducing your activity. Well, when you're a 30-year-old guy with, you know, kids and they're boys and you're active, you can't curtail your life. And this is what we're doing now, though. If it hurts to get up and walk, or if it hurts to get up, how many people have stopped surfing or stopped skiing? That's not true. You shouldn't be doing this. We shouldn't be scaling back. So I actually developed some techniques to reverse arthritis. Now, we can go over the technical verbiage of this, because this is what the medical world is, and most people are indoctrinated in the medical world, and there's certain categories of arthritis. Okay, in the real world it doesn't make sense, okay, but in the crazy world that we're in now, osteoarthritis is the most common type. This is how it's done. Okay, how many doctors do we have? 1, 2, 3? Okay. Okay, so now you're taught to memorize and regurgitate, right? Yep. Okay, good. So if I gave you the 3 criteria, you could name, you know, we have bilateral. Is that rheumatoid or osteo? Rheumatoid. There you go, rheumatoid. See, memorize and regurgitate. Now, which one's an autoimmune disorder? Rheumatoid. Rheumatoid, excellent. Fantastic. I think he just took the boards. Okay, so yes, you're right. But this is how the medical world is. It's looking at a collection of symptoms, putting in a category so you know that you're going to treat those 2 types of arthritis differently. Yes? That's true. In crazy world. Okay? In real world, we're looking at, because everybody that has rheumatoid arthritis, do they have it for the same reason? No. Does everybody have osteoarthritis for the exact same reason? Let's say 10 people in this room had high blood pressure. Do they all have high blood pressure for the same reason? No. Then how can we treat it the same? So what we need to do is throw away the labels and start looking at each individual aspect of it. So all these rheumatic diseases, they're not really diseases. They're just the body adapting. Lupus, scleroderma, I mean, these aren't, you got to treat it on an individual basis. But our society is looping it up so that even if he treats osteoarthritis with, say, you know, Advil, aspirin, or Aleve. Let's say you treat it with aspirin. Okay, that's a common drug, right? Okay, he's going to treat it with aspirin. That's the 4th deadliest drug in America, the leading cause of kidney disease. His patient gets treated with the aspirin, okay, which is an appropriate protocol. The patient gets increases rate of stroke, so his patient strokes out, has kidney disease, and dies. He's not liable because he treated it appropriately. Okay, so we're going to change this. So arthritis, the most common type, is a mechanical problem. When you see people and they say, oh, it's from old age. I get patients in that have been told that it's from old age from their doctor. Okay, this one on the left, grade 1, means that the bone has lost its normal position of motion, but there's no destruction of the disc or bone. That's grade 1 arthritis. Definition of grade 2 is it's still not in the right position, but there's beginning destruction of the disc or bone. Grade 3 is there's more advancing. It's not in the right position, but there's more destruction of the disc and bone. Grade 4 means it's fused and you're done. Now, when you look at this is degenerated, yes? It's a different shape. How can you say that this is from age when those are the same age? Do you see the problem there? Oh, so they're the same age, so it can't be from old age. So if you've been told that, that's not only completely untrue, it's ignorant. Now, this is Kirkcaldy and Willis. I taught biomechanics, okay? This is the biomechanics Bible. What they did is they took cadavers, from old cadavers and young cadavers, you know, and they put them, the joints under torsion and tests. What they found was that elderly joints were just as strong as young joints. That means we don't lose strength. So if you're feeling brittle because you're 30 or older, okay, that's not true. Okay, because ligaments, everything, they all can remain the same strength, but it has to do with digestion. See, the joints are only about 14 months old, so if you have poor digestion, you can't break the aminos, the proteins to amino acids and the fats to add fatty acids, so you become nutrient deficient. So you start to wrinkle and you start to shrink because you can't generate the healthy tissue. And what's interesting, so this says degenerative changes don't appear unless there's trauma. Wow. So that means that these, grade 1, grade 2, and grade 3, are an incident of trauma, not degeneration. Okay, so it's an incident. So if it's trauma, we can fix it. Okay, so when we look at this, look at all joints. And remember, there is going to be a test. I'm going to give away a free book at the end of this, so I'm just saying that, you know, from an old teacher's perspective. All joints are two joints coming together, surrounded by joint capsule filled with synovial fluid. Now, synovial fluid is a superfiltrate blood. Every time you open and close a joint, I'm creating a negative pressure and a positive pressure. Negative pressure, that's causing a pumping action to fill that joint up with fluid. The same thing like when you're walking, when you're opening your joints, all of that. So just the act of moving the joint allows the superfiltrated blood to get in there. Hey, wait a second, think of this. So if blood's not healthy, every time you move a joint, you wouldn't have healthy fluid transfer. So the joints might start to wear out. Oh gosh, that's actually true. Let's look at this. So in our society, I used to watch Animal Kingdom, Marlon Perkins, okay, you know, National Geographic Channel. You'd see these Aborigines, okay, they look like friggin' athletes. Lean, strong, healthy, 60, 70, still hunting caribou and antelope. And okay, now, of course, you might say they're health nuts. You know, they ate only organic and they exercised every day. Okay, we now, in our society, have a perfect storm of sickness and death. In January, we're going to talk about the 6th extinction event. Okay, there have been 5 mass extinction events on planet Earth. We're currently in the 6th one, okay, and this is evidence of it now. Since 1950 to now, over 90% of the large fish species in our oceans are gone. We have 30 more years and the fish oceans are emptied, and we'll die off before that. So this is a wake-up call that we need to wake up, that what we're being exposed to is inappropriate. Look at the human body. I know we're talking about arthritis, but just look at the human body. Do we need food? Yes, I mean, there's some breatharians, but we actually need food, okay? We have to be able to break down that food. So you have a choice. You can have normal food or the processed, refined, genetically modified, okay? We need to have elimination. Now, what's wild is, I know you can memorize and regurgitate, how often are you supposed to eliminate? And it's supposed to be once every 3 days or 3 times a day, anywhere in between. Is that still? Buddy, if you're going poop every 3 days, you're in deep trouble. Okay. So you're taking in toxins, you got to have elimination. So you got to have food, you got to have elimination, you got to have movement. There's movement deficiency syndrome. You have lymph fluid that if you don't move every day, it's stagnant. Every time you move, bend, turn, and twist. And remember, you've got those joints if they don't open and close. So this means if you have a sedentary lifestyle, an office job, you're in this position for 8 hours a day. By gosh, the joints are not going to get healthy. They're going to start to deteriorate. So we need social and mental health. Why? Because we're social beings. Too many times we start to get, if you hurt and you can't get outside, we've already done multiple studies on depression and anxiety, how if you get into groups, it's better. I mean, how long has AA been around? How long has talk therapy been around? You know, everybody needs friends, and we need social interaction. And now the healthcare, in case there's a trauma, or some type of wound, or some type of cut, or some type of, okay, so we're always going to need some type of care of our health. Okay, does that make sense? Because we're going to be exposed to some type of trauma, toxin, or deficiency. Now, the food, if you go into, I just wanted you to look at the big red box on the right. This is the state of health. Remember, we're in the 6th extinction event. The system is dying, our population is dying. We're talking about arthritis, and we should not wear out. I'm showing you arthritic joints, and right above it, they're healthy joints. So right now, the current state, 1 in 3 Americans have heart conditions, 1 in 3 have cancer, 1 in 4, 25% have mental disorders. Don't look on the right or left to you. Okay, which one in here has it? Okay, and then you look at it, COPD, that's breathing problems. We have a problem with breathing? You're kidding. That's the 3rd leading cause of death. Joint disorders, diabetes, high blood pressure. I mean, this is outrageous. And why? Because the food choices, if you choose poorly, you get those diseases. Elimination, if you're not eliminating correctly, you're going to get those diseases. If you have movement deficiency syndrome, if you're not moving at half hour a day, okay, every day, you have to. I mean, it's vital. If you're in a wheelchair, you just got to do breathing exercises and move your arms. If your knees are destroyed, if your ankles are destroyed, you can do movement, breathing, bending, turning, twisting. I've given twisting exercises to quadriplegics, okay, and they're able to do it. So believe me, I've got 3 quadriplegics now, and they all do exercises, at least a half hour a day. And if you don't do that, what do you get? Disease. Social and mental health. If you don't have time for social interaction, if you don't have time for yourself, does anybody want to decompress? You got to try a boat. Oh, sorry, that's what I do. Okay, but you know, I mean, if you don't, your life is out of balance. You're going to have stress. You're going to have increased cortisol. Increased cortisol means you're going to have decreased digestion. Decreased digestion, you can't break those proteins down. You can't break the proteins down. You're going to have ill health. See, those aren't diseases in the red box. They're just the body, physical, chemical, and emotional stress. But now here's the weird part. Healthcare, any therapy that is done to you for your health, to maintain your health, if it's working with the body, it's going to be effective. If you have a fever and you're sweating, what's the body trying to do? It's trying to cool itself off, right? So any therapy would be maybe a tepid sponge bath or room temperature bath to help cool the body down. If you have a fever and you're shivering, what's the body trying to do? Warm up. So a hot bath, a blanket would be appropriate. See, those are therapies that are working with the symptoms of the body. However, nowadays, we're not. We're trying to circumvent or second guess the body's processes. If there's a pain, what do you get? Pain reliever. If there's a digestion problem, you don't fix the food, you give an antacid. If there's high blood pressure, you give a chemical to lower it. If there's high cholesterol, you give another chemical to lower it. And that's every one of those therapies works against the natural processes. It's working against our planet, because the more toxic therapies we do to our body, hey, we're in the 6th mass extinction event. We're not going to be here. Now this is the benefit, okay, of the psychotic nature. See, it's only going to be changed from the grassroots. It cannot be changed from the top. These are the costs that are going to bankrupt America, and this is the cost in billions, okay, billions. Now, these are all preventable diseases. You're talking 97% of all of these diseases are preventable, and I mean heart disease, cancer, mental disorder, COPD. They're preventable, at least 97%. And so it's actually bankrupting America. That's why Obamacare, you don't really need to worry about it. It's not going to, do you know the theory behind Obamacare? They're going to get everybody in America to get insurance. Now, they're thinking old ways. See, they're hoping that the young people, 21 and over, people that don't get sick, are going to be flooding the system with money so that they'll be able to pay for the people who have cancer, which some medications are $75,000 a year for one drug for cancer. Okay, I don't know how many 20-year-olds it's going to take to cover that $75,000. That's the theory. Okay, that young people are going to be there to pay for the old people. However, they're not looking at the current statistics. 50% of America's children have a chronic illness. Okay, 21% are mentally damaged. So if there are healthcare professionals here, there are, okay, you don't need to worry about it. Okay, it's done. Now, everything that you do, imagine this. Okay, imagine you're treading water with a backpack. Okay, how many divers are in here? Okay, good. Okay, remember what it was like to do the diving? Okay, it's because you got to tread water for like 20 minutes. Okay, imagine treading it with a backpack. It'd be harder. What if there were rocks in the backpack? It'd be even harder. Okay, so I want you to have that analogy. The kids that we're burdening now with, 74 vaccines, soy-based formula, antibiotics, C-section birth, births that the kid is pulled out and then the cord is clamped off so the cord blood can't drain in there. I mean, all of these therapies that are working against the body. Forget that, she's got a tough start to begin with. That's why 50% of the kids have a chronic illness. Then they get a little bit older, okay, because each trauma, each therapy that is done to them weighs them down. It destroys their life. It sucks the life force out of you. Then you get young teenagers, high fructose corn syrup, genetically modified high fructose corn syrup. That's the #1 source of calories. Ritalin, antidepressants, Motrin, Aleve. This is common stuff. And then when they get to an adults, we should not be surprised that they're taking every other drug on the planet. So it's just ridiculous. This right here, we're talking about arthritis reversal. We're talking about regenerating the tissue. And when two bones coming together, surrounded by a joint capsule, filled with a superfiltrate of blood, that blood is the primary thing that restores joints. You have to have healthy nutrition. If you don't have healthy nutrition, healthy movement, healthy nerve supply, it's not going to get better. It's going to get worse. Now, I just answered an email, and they said, well, since genetically modified foods and regular foods are both broken down to amino acids and fats and carbohydrates, what's the difference? Well, if you look at the animal studies, it does cause tumor growth, it does cause infertility, it does cause genetic alterations. But when you modify the DNA of a plant with a bacteria, that's unusual. We've never seen that before. So now, not only is the corn oil and soy oil massively different, because we should have a 1-to-1 or a 3-to-1 omega-6 to omega-3 ratio, and this is like 20-to-1 or 60-to-1 or 77-to-1, which is toxic and will cause disease. We know this will cause disease. Now, let's kick it up a notch. What if we modify it genetically? Oh, what if we soak it? I know. It's like, oh my gosh. And you don't need to look far. Look at the experiment out there. Mental disorders, okay, 1 in 4. Cancer, 1 in 3. Heart disease. And this is standard, so it needs to be changed. This is a store similar to where I buy oil for my car because I burn veggie oil. You don't want to eat this stuff. I mean, but this is, the public doesn't know. We're in the 6th mass extinction event. This is why. It's self-induced. It doesn't need to be this way. See, this is a healthy blood sample. Okay, now if you've heard of blood thinners like warfarin or Coumadin, blood does not clot in the arteries. Blood does not clot in the arteries. Blood does not clot in the arteries. Okay, why? Because I'm continually asked, I got to take this blood thinner because my blood clots in the arteries. No, to clot, you have to have it exposed to air. Blood does clump in the arteries. I know, isn't that cool? I know. It's because if you're protein deficient, you have poor digestion, or you have polyunsaturated fats, which is like corn oil and soy oil, it makes the blood vessels sticky and they stick together. What they stick together like this, they can't hold as much oxygen. If they can't hold as much oxygen, what has to happen to pressure? It has to increase. Oh, so if you have a standard American diet with high in polyunsaturated fats, then that means pressure is going to have to go up. Now, if pressure goes up, what do we have to take? Because we're working against the body in healthcare, you're going to take a blood pressure drug to chemically force it down low. Wow, would that cause disease? Yeah. Hey, I'm sorry, we're talking about arthritis. Arthritis, 2 bones coming together, surrounded by a joint capsule. What's in that joint capsule? What's it called? Synovial fluid. Okay, synovial fluid. So synovial fluid's in there. That's a superfiltrate of what? Blood. I know. So if we have healthy blood, you're going to get good, healthy synovial fluid production. Unhealthy blood? Oh my gosh. So does that mean that the soy oil, corn oil, genetically modified oils that cause the blood to be sticky are going to cause arthritic changes? Yes or yes? Yes. I know. Isn't that cool? I know. And then we also got to look at the functions of blood. Since we're toxifying the blood, how old is blood? About 120 days old. So that means no matter what horrible lifestyle you've been exposed to, this mass extinction event can be reversed in 120 days. We just got to wake up. Okay, that's it. So if we wake up to the fact that we're being toxically exposed and this is in disharmony with our planet, we can turn it around. So we don't have to be extinct, okay? Now, this right here is amazing. I was taught by one of the most brilliant emergency surgeons. Okay, his name was Dr. Neil Hirsch. He told me that he was in emergency. He had this one guy drew the blood out, okay, to do a blood test. They set it in a vial, and they set it in a little tray thing, and it separated into fat and blood. That's a real blood sample of somebody that just had a burger, fries, and chocolate shake. That it actually gets in there. So you got now. I know you're thinking that vial on the right can't hold a lot of oxygen. You're right. It can't. It's undigested. It's not healthy. Okay. So this is this thick goo is flowing around in your system. Now, what if you had arterial damage? That's bad. Now, this picture on the left, the A and B, that is an artery on the left that's occluded. It's clogged up. The artery on the right is 90 days later after a plant-based diet. So fat, animal-based diet closes arteries. It takes about 90 days to open the arteries. Okay, I encourage everybody to watch the movie Eating. You're actually going to see a doctor who had a heart attack, cleaned his arteries. So you got a choice here. If you got clogged arteries, you got an artery that's big and starts to get smaller, what has to happen to pressure to keep the same amount of oxygen there? Has to increase, right? Okay, so your body's going to present with damaged, sick blood, with high blood pressure, high cholesterol. Wait, since the blood's unhealthy, do you think it's going to filter through those two bones with the synovial membrane? So wait a second, so joint pain might be a factor. In fact, the bird and the canary in the mine shaft, maybe joint pain is the first clue that the blood's not healthy, that a sedentary lifestyle. So wow, so joint pain really isn't a problem. It's actually a clue that there is a problem. I know, isn't that cool? It's like really respecting the body, that it's there for a reason. So your choice, okay, is plant-based diet, daily exercise, actually daily meditation, and a healthy nervous system. It can't be that easy. Okay, now this is I don't know if Dumb and Dumber actually invented angioplasty. Okay, if you've ever seen that movie, I'm sure they did. If you have a damaged artery, do you think that's problem with just one artery, or do you think that's systemic? You think, yeah, I think it's systemic too. So how can these guys get away with doing a bypass surgery when every artery in the body's damaged? It's illogical. Okay, so you got, this is crazy world. You go in, you have lack of oxygen going in there. In the future world, after this mass extinction event, when these guys aren't here anymore, they're going to say, your arteries are obviously clogged. We need to get soluble fibers in there, get you on a plant-based diet so you can clean the arteries. Okay, they're not going to say, hey, I got an idea. I'm going to put this tube up this vein in your leg. It's going to go up around here, over to your heart. Then we're going to expand open that artery, and then we're going to pull it back out. Okay? Now, it's not going to clean the artery. It's just going to open it up temporarily. Okay, no, I got a better idea. That didn't work. Okay, so I'm going to take this thing, go up the leg, come up in here, go right past the lung, over and jam it in the floor of this one artery, and then I'm going to put a wire cage inside of the artery. Yeah, that'll fix it. Okay, that's when it takes 90 days to clean the arteries. It's just, it doesn't make sense. So we've got our choices. And then up here on the left, again, this is a clogged artery, okay, on an angiogram on the left, an open artery on the right, after a plant-based diet cleaning the arteries. So it shouldn't even be like I mean, granted, doctors and hospitals aren't going to get paid if you switch to a plant-based diet. Mm-hmm. Okay, and I'm okay with that. This is standard. Okay, and this is, remember, this is the 6th mass extinction event. This is standard. Now, here's a guy, 56 years old, pain reliever. That's the #1 thing he started on. Now, do you think he has healthy blood or sick blood when he's in pain? When he's under pain, is his thyroid functioning well or adrenals functioning well? Remember, we've done like multiple talks on the thyroid. Under pain, your body, your adrenal glands kick in, and that slows down the thyroid function. So cortisol kicks in because it's a stress hormone that lowers thyroid function. So under pain, wait a second, he just took a Tylenol. Is his body still under the stress response? Yes. It still is. His brain just isn't aware of it. Wow. So we're covering up all these symptoms like blood pressure, high blood pressure, or blood pressure, pain, cholesterol, indigestion. We're covering up all these symptoms that his body's given us. And is any one of these drug therapies working with the body? Is any of the drugs long term, are they going to make him healthier or sicker? Sicker, yeah. So he was on this for years. Comes in here, this is his x-ray, it's obviously messed up. So I teach him how to take the blood pressure, I teach him how to, how to get it corrected, teach him how to sleep, teach him how to meditate, teach him how to get adjusted, and here he is. 90 days later, drug-free. Now, he was really happy because he feels better. Okay, he was doing the drugs. How many people are doing 9 and 10 drugs and feel just great? I'm not kidding. Okay, I see this every day. Okay, we get about 4 to 8 new patients every day. Okay, on a busy day we'll get like 10 or 12 new patients. And every day they're taking drugs. Okay, now I'm seeing more and more people not taking any drugs, which is unusual. I used to just say, well, how many drugs are you taking? Oh, which ones? Okay, good. And it's usual ones: blood pressure, cholesterol, blood sugar. Okay, yeah. Oh, no cholesterol drugs. Okay, and you start finding out. It's crazy. It's crazy that this is considered normal. I have never met anyone taking more than 3 drugs that felt good. Okay, it doesn't. So when we're talking about destruction of the cells, your body builds 1 billion cells a day, you destroy 1 billion cells a day. This process is called oxidation. If you handle oxidation correctly, you live long. This is called harmony. You are going to kill 1 billion cells today. You are going to build 1 billion cells today. So every aspect that you do during the day, if it's in harmony with your body, that's going to give you a healthy life. If you have a poor diet, you take drugs, you have vaccinations, which is absolutely against the harmony of the body, pollution, injury, even natural aging and stress. If you handle natural aging well, this process of oxidation produces free radicals. Free radicals can actually cause cancer and disease. So you have to take an antioxidant. Do you know what an antioxidant is? Fruits and vegetables. Okay, so you have to take fruits and vegetables every day. Wow, I know, it seems like too simple. This is good. The aspirin a day for a healthy heart. I'm reading this article, okay, and it's just fun. It just came out, okay. Big headlines. What was it? 10 to 15%. You're 45. They mentioned 45. This actually is the actual article or study. Between 33 and 46 fewer deaths if you take an aspirin a day for every 100,000 people. So that means 100,000 people have to take a drug every day their entire life to save 30 to 45 people. I'm okay with that. I would take something to save a life. Are there any negatives to it? Yes, there are. Okay, 37% increase in gastrointestinal bleeding, 35% average increase in stroke. It is the 4th deadliest drug in America. There's a 200% increase in blindness, age-related macular degeneration. It's the leading cause of kidney disease. To save 45 people out of 100,000. Now, again, I like the 45 people we want to save. I don't like the couple hundred people we killed, but I don't think that's. Is there anything better that we can do to help the heart? Okay, that won't kill people from stroke or gastrointestinal bleeding or blindness. Anyone? Anyone? Fruits and vegetables? How about I detail it out in my new book? And I did, oh, wait, I got to read this. This is really fun. Because I just, when you read a bunch of science articles, you just got to have fun. Clear that there's an incredibly fine balance between possible benefits and the risk of intervention. We need to be extremely careful about over-promoting aspirin intervention without having first fully understood these negative side effects. They will never understand the negative side effects, ever, because the pharmaceutical industry pays for this, and it doesn't work. If everybody in this one row here took an aspirin, would you all have the exact same results? No! It's illogical. It works against the body. It's a chemical. The body is not designed to protect it. And here, non-steroidal anti-inflammatories decrease bone production. This is what's commonly used. It works against the body. This one here, again, the little purple pill, antacids. Antacids, if you're having indigestion, it means you can't digest something. Okay? It means it's not good for your body. Fix the digestive process. The cortisol, thyroid, metabolic balance. And I know everyone, you know, so many women are misdiagnosed with a low-functioning thyroid. Then they're taking levothyroxine. And it's not. If we have high stress, the thyroid's going to be low. Low thyroid only means that there's physical, chemical, or emotional stress or toxic or deficiency. If you have chronic adrenal function, chronic cortisol, you're going to have bone destruction. What solves this imbalance here? What lowers cortisol? A healthy thyroid function. How do you get healthy thyroid function? More fruits and vegetables and fresh water. What helps the thyroid? Healthy gut. So this means you can't put anything in there that you can't digest. Low cortisol, so that's the same thing. Healthy food, healthy water, and low stress. That can't be. Does that mean that we can fix thyroid by getting, you know, healthy water, healthy function, healthy food, healthy stress? Can it be that simple? Yeah, I think it can. It's interesting. This is virtually every disease on the planet. It's from oxidative stress. This means that you know, that billion cells that you're breaking down every day. And I'm bringing this up. We're talking about arthritis, but by gosh, my joints are only about 14 months old. Okay, so if I can't handle that oxidative stress of continually regenerating cartilage, I couldn't adjust a couple hundred people a day. Okay, so I've got to keep doing this, and I've been doing this every day for like 54 years. It works. If you can't handle that, so does that mean that like atherosclerosis, high blood pressure, chronic inflammation, all of these, they're not diseases. They're a problem with oxidative stress that the person has got deficiency or toxicity in the diet. They're not handling the cell transfer well. It can't be that easy, but it really, really is. I mean, we can look at this chart of long-term cortisol. Cortisol is a brilliant anti-inflammatory. Brilliant. So if you have joint pain, cortisol is going to be up. However, if it's up long term, what are the misdiagnoses? Poor cognitive performance. So is that mental disorder, Alzheimer's, dementia? Dementia costs more in cancer in our country. Blood sugar imbalances, osteoporosis. I mean, all this stuff. It's not needed. This is the oldest yoga instructor. I think she's 94 now. Okay, I'm sure she's going to be doing it to about 120. I can't do a balance move like that. Okay? I could lift her with one hand, but I couldn't balance like that. I mean, that's hard to do. So why is she 94, exercising, productive, healthy, dynamic? And why are those people in their 60s, 70s, and 80s in wheelchairs and assisted living? We need to go to the assisted living centers, break open the roof so they get direct sunlight, throw away all the garbage food, flush the drugs down the toilets. Of course, that would be bad for the sewage treatment plant because they're toxic. Well, we'll find something. We'll put them in the nuclear cast and send them to Fukushima, okay, with the drugs. Okay, so you know, we got to, would the population be healthier? Absolutely, it has to be. This gal here just came back yesterday. Anytime a patient doesn't get the big picture, it breaks my heart. I feel like it was my fault. I feel like I totally screwed up. I could have said this. I could have said that. I could have been more forceful. I could have been less forceful. Okay, so we're talking 2011. She comes in. This is her. 17-degree scoliosis on the bottom. I mean, horrible. Multiple drugs. And she was 65. That's young in my world. And she couldn't walk hardly up. She had a 2-story place. She wanted to sell it to get a 1-story place, taking multiple drugs, and just miserable. Her daughter comes in and says, can you help my mom? Sure, she comes in. 90 days later, she went from, what was it, I think 6 medications down to 2. She was able to walk a half hour, feeling great. And then she dropped out of care. And this just mind-boggling to me. Hun, you got grade 3 arthritis. It takes 3 to 5 years to get the maximum correction. You're still doing a couple of drugs. You can't stop halfway. You're almost there. And I didn't see her. So she went the medical route. And this is kind of a cool experiment. It's sick and cruel, but it's kind of cool because she dropped out of care for 2 years. I mean, that's her original, that's her second. So she went from 17 degrees to 7. She went from 6 medications down to 2. What happened over the last 2 years of medical care? 3 epidural shots, multiple drugs. She can't walk hardly from the car to here. Okay, and what is that, 50 feet? Okay, in agony all the time. She did sell her 2-story house and got a 1-story. Now she can barely go out and get the newspaper. Okay, she just got the big picture. But this is what got her. I was able to say, hon, this is what you were. This is what we did. This is what you are now. Obviously, the therapies you're working with aren't helping you. And of course, her pain management. Okay, can you imagine that? That's your job, managing pain, not correcting pain, not pain solution, not any of that stuff. Her pain management doctor is just drugs and surgery and shots. That's illogical. That she came back. I love her. Yeah. We have to anything that works with the harmony. This is magic we're working with. We know that sperm hits the egg, but in our ignorant point of view, we have no freaking clue at how it doubles and triples and quadruples the cells. We don't know how the heart forms in 24 days, how the nervous system forms within 7 hours. We don't know how a stem cell can become a brain cell, a liver cell, or a kidney cell. We don't know. We don't know how the right number of cells go to that spleen and grow and then stop when they don't need to grow anymore. How come our spleens don't take over my entire leg? How come they're all in this? We don't know. See, we're working with harmony of the nature. I mean, this is just brilliant. We know that the colors here are full of phytonutrients because the plants have been exposed to viruses, funguses, and bacteria for eons. If we eat that, we get some of that benefit. Again, that's living in harmony with nature. This is all you need to reverse arthritis. This is all you need to reverse arthritis. You need to have a healthy nervous system. That's primary. You've got to have, in the healthy nervous system, subluxation. That means that we're realigning the joints. Because what is arthritis from? It's trauma and a misalignment. So we realign the joints. That means the joint's going to regenerate. Whose joint in here isn't going to regenerate? Everybody. So you want it regenerated healthy or regenerated sick? Healthy? I think so too. I think it's a good idea. I think we'll take that. Okay, regular exercise. Just a half hour a day. Proper nutrition. This means if man makes it, you don't eat it. If it's modified genetically, send it to the government. People that only should eat genetically modified foods are the scientists that invented it. Okay, people that should only get vaccinations are the vaccine manufacturers. Okay, let's do an experiment on them. 40 years from now, if they have less cancers, good, then I'll start vaccinating. Sufficient rest. This means deep sleep every night. This means journaling might be necessary if you have a high-stress lifestyle. This means deep sleep every night. You can't watch TV and fall asleep in front of the TV. This means you have to get deep sleep, read, have a ritual for sleep. And prayer and meditation, absolutely vital to realize that we're something bigger than ourselves. Imagine if we were, connected to the planet. Wait, we are, aren't we? Okay, oh, cool. Okay, good. There's the 6th mass extinction event going on. If we don't start understanding that we're part of the planet and all our harmonies in there, we're not going to be making it. Okay, now all of this stuff in our handout, I know the handout is ridiculously big, but have you ever tried to you got some really cool stuff and you say, well, I want to make it smaller, but it's too good to keep in there? Okay. So here's a number of different foods and diseases. And all those that are watching it on YouTube, you get it 7 days for free. You can download this handout, okay? And it's natural pain relievers, anti-inflammatories. It's just food that works as medicine.